Today, we are in the office of celebrity plastic surgeon Dr. Kanodia, and he is about to show us one of the most on-trend body contouring techniques, and that is Emsculpt. So he even demonstrated how to use this on Keeping Up with the Kardashians on Kim, and today he is going to share with Cosmetic Town exactly how this treatment works.
Emsculpt is spelled Emsculpt, and electromagnetic energy is being implemented into your muscle through paddles, and it contracts the muscle in a very severe form. So it's called supramuscular contraction. A very high intensity energy comes through the paddles and makes these muscles contract. So it's more or less you're working out in a very intense way. When you're doing it for the abdomen, it is like doing crunches. Half an hour session is like doing 20,000 crunches. Wow. Just imagine. I mean, how is it possible? But it does. I mean, it just like beats the hell out of the muscles. And if you do the glutes, so that's like doing the squats. But the fun part of it, not fun, but the effective part of it is that it goes to the depth of the muscle, the inner depth of the muscle, which is very difficult to accomplish when you're doing the real squats or real crunches. Because this muscle, it goes down 7 centimeters deep to be able to get the whole depth of the muscle and make those back fibers strong. And that's the beauty of this machine.
Who is the ideal candidate for this procedure?
I think everybody is an ideal candidate in a way, men, women, young, old, and somebody who's in excellent shape, super athlete.
Today I'm hoping to achieve kind of like a firmer look on my glutes. I do sort of gain weight there first, which is super frustrating. So whenever I am gaining weight, that's kind of the first place it goes. And so I definitely try and work harder during my workouts to reduce the fat in that area, and I'm hoping that Emsculpt will definitely tone it and make it look a little bit more firm and plump.
So let's talk about the abdomen. So here, depending on the size of the abdomen, you can put one pedal or two pedals, and then it's connected to the machine. And as I said, there are 2 cycles in the machine. One is to contract the muscle, and the other one is for lymphatic drainage and fat removal. So half an hour session. And what you do is, so everybody, it literally feels like you're working out. You're doing crunches, right? So you start slowly, and you start at level 20, okay? And the max is 100. So what I do typically, I'll go into the room, start talking to them, and this is called vocal anesthesia, and they're 20, and just gradually keep increasing as I'm chatting with them about various things in life. And 30 to 40 to 50, and then if they start to complain, I said, all right, let's start breathing, okay? So when it contracts, you go, breathe out, breathe out. So by that, vocal anesthesia, my goal is to take them all the way up to 100. And because higher the contraction, better the result will be. So I want to give them the best result. And for that reason, I'm always there to talk to the patient and take them up to 100 because I want the best result. I recommend 4 sessions and 2 days apart. But we have a lot of out-of-town patients and they don't have 2 days apart, so we do them 1 day apart and no detriment to it at all. And then some people cannot commit to 2 days, 2 days, 2 days, 2 days. And so they can do 2 or 1 and then come back 5 days later or 7 days later or 2 weeks later. It will still be effective. You see some improvement right away. More than see the improvement, you feel the improvement because the muscles feel stronger. You stand differently. Your core is more engaged. In terms of glutes, almost 1 session gives you a little bit of a butt lift, So no longer you need the injections and fat transfer. Those are very invasive procedures in the sense that there's downtime and post-operatively. But this one is all very organic by increasing the contraction and the strength and the tonicity of the muscle. So step one is to put the binders, the belts, and then insert the paddles. Step two is to start the machine and start it slowly, get the patient's confidence, be able to tolerate the stronger contractions, and try and take it up all the way up to 100.
How do you notice that this procedure specifically just changes your patient's confidence?
I think just the way the patients come back for treatments and the compliments they have for the machine and how they feel about themselves. Like if you tighten the abs, your core is stronger. You stand differently. You walk differently. You think differently. And the Indian way of looking, the chakra, the spine is straighter, so the chakras are better, because now the energy is flowing up and down because your posture is better. And the posture is better because your abs are stronger. Your abs are stronger because you use the Emsculpt. So it's got a very nice positive chain of events which I'm really enjoying.